Hi, everyone. Welcome to week 4 of Intro to Clinical Psychology. This week, we will be focusing on Chapter 5, Ethical and Professional Issues in Clinical Psychology. This is a pretty fun chapter because I think it kind of teaches you how to think like a psychologist. So a lot of what we're going to talk about in the class is really standardized. When we do assessments and treatment, we're following kind of the best recommended protocols. But when it comes to ethical dilemmas, it takes a particular kind of skill to think like a psychologist, because a lot of situations aren't necessarily straightforward. So today we'll be talking about the APA guidelines for ethics and then walking through different scenarios that could come up in practice. I also want to note that I will be offering an extra credit opportunity. So it will be a worksheet with different ethical scenarios that you can practice going through. And the way I'm going to grade it is that it can replace your lowest quiz score or weekly response. So it can be worth up to 30 points. So if you happen to miss a quiz or something, this can be a way to make up those points. So I will be posting that separately on Perusall. So the American Psychological Association developed a code of ethics that was first published in 1953. So this is, again, part of that kind of wave of standardizing the field that happened after World War II. There have been 9 revisions since 1953, but, a lot of the main principles and standards have been kind of established over these past 80 years. So the APA actually governs all types of psychologists. So the ethical code covers people who maybe are cognitive psychologists doing research, social psychologists, but a lot of the ethics are very specific and relevant to clinical psychology because of the type of activities that we engage in. And there are 2 different components of the code of ethics. So there are 5 general ethical principles, and these are considered aspirational. So these are directions that kind of like values that you will never fully reach, but they are ways in which psychologists should be working with these values in mind. And we'll go over these in a moment. Whereas the ethical standards are more enforceable. These are more like laws. So the ethical standards are more like if you break one of these rules, then you could actually lose your license. Whereas a general principle are more these aspirational values that psychologists should work within. And so these 5 ethical principles are outlined here, and I'm going to talk through them, and we're going to be returning to them over and over again during this week. So the first principle is beneficence and non-maleficence. So what this essentially means is that clinical psychologists should aim to benefit clients without harming clients. Sounds pretty straightforward. It's within our goals as psychologists to improve people's lives, and this should happen without harming them. So there's kind of 2 ideas baked in here. So it's both about adding beneficence, adding positive things to the client's life, and avoiding harm. So there's 2 components in that first ethical principle. The second one is fidelity and responsibility. And this essentially refers to establishing trusting relationships in the community and acting with an awareness of the responsibility to society. So when we're talking about fidelity, we're talking about fidelity to the profession. So we are wanting society to trust psychologists as a whole and to, as an individual, be working within that kind of responsibility to society as a psychologist. The third principle is integrity, and this is promoting accuracy, honesty, and truthfulness in our work. Then we have justice, which is encouraging fairness and justice regarding access to services, the procedures we use, and the research we're conducting. And lastly, we have respect for people's rights and dignity. And so this is really just supporting people's autonomy and worth of all people. And kind of an interesting angle to think about this one is that also includes the psychologists themselves. So this is really just recognizing that all people have individual rights, and we'll get into how that can come into play in a little bit. So again, these are the 5 general ethical principles. They are more of these aspirational values that psychologists should be kind of constantly working towards. We then have different ethical standards. And so they're organized into 10 different chapters. We're not going to go into this in depth in this class. If you become a therapist or you finish grad school, then part of the licensing process is to become much more familiar with these ethical standards. But it's a bit beyond the scope of this class. But they essentially fall into these 10 different chapters. So the first chapter actually kind of includes those 5 aspirational principles, and it's about how to resolve ethical issues. There's a chapter on competence and how to define what a competent psychologist is. There's a chapter on human relations, privacy and confidentiality, advertising and other public statements made by psychologists, record keeping and fees, education and training. So this would include some of those standardized requirements for graduate programs and licensure, research and publication, assessment, and therapy. And so when we think about ethical decision-making, there are these ethical standards that you just have to do, and then there's the aspirational values that we can work towards. And so you can kind of think about ethical decision-making as being on this spectrum from negative to positive, where negative decision-making would be doing just the bare minimum to avoid trouble. So you write notes that you have to do, you get your clients to sign informed consent forms, everything looks good on paper, and you're just not going to lose your license. But then on the other end, we can have positive ethical decision-making. And this is really making efforts to maximize the ethics of professional behavior. And so this is more like, instead of just having a client sign a consent form, you're really going to make sure that they understand it on an ongoing basis and really strive to be really benefiting your clients the most at all times, and to handle ethical decisions appropriately. So a helpful way to think about ethical decision-making when a situation comes up is offered to us by Celia Fisher, who developed this ethical decision-making model. And so the first step is, prior to any ethical dilemmas arising in your clinical practice, is to just make a commitment to doing what is ethically appropriate. And so this relates to being more on that positive end of ethical decision-making. So you're already committing that when things arise, you're going to do your best to have a positive outcome. The second step is to become familiar with the APA ethical code. Again, this is something that you do kind of later on in your training when you're like kind of finishing grad school and working on licensure. It can also vary state to state. So that's why, once you're kind of more established and about to go into the field, that's a good time to really get familiar with this code of ethics. So then when a situation arises, it's helpful to first consult any professional guidelines or laws relevant to the situation at hand. So this could be the APA ethical code. It could also be state laws. It could be things specific to your specific field, such as like the Social Work Licensing Board, but just consulting kind of any of these resources that are available. Next, it's recommended to try to understand the perspectives of different parties affected by the actions you might take. So this is in a way thinking about kind of all the different outcomes or choices that you could make, and then kind of thinking about what could happen and how would this affect your client? How would this affect you and your practice? And as part of this step, it's recommended to consult with colleagues for additional input and discussion. And when consulting with colleagues, it's always important to protect confidentiality of your client. The next step is to generate and evaluate your alternatives. So this is thinking about all those different possible outcomes, looking at the pros and cons, and then selecting one choice and implementing it to see if it's going to resolve the issue. It's always good to pick the one that seems the most ethically appropriate to start. And lastly, to monitor and evaluate if your course of action worked. Is the ethical dilemma resolved? If it's not, then modify the plan, continue to evaluate the ethical plan as necessary. So you might go back to step 3 or 4 to kind of pick your plan B. So this model is a really helpful guideline for when an ethical dilemma does arise where there's not one clear decision point to follow these steps to generate a plan. And so what are ethical dilemmas? Ethical dilemmas, so some situations, the decision is clear. It's in the ethical standards. And so there's kind of just like a clear-cut guideline. And if you don't do it, then you could lose your license. So it makes sense to follow the law or the rule. So things like avoiding dual relationships with clients, keeping their detailed therapy information confidential, the rules against advertising individual services. These are all built into those ethical standards. And it's pretty clear cut. You are just simply not allowed to have a romantic relationship with a client. And so there's that, like, the answer is very clear. But there are other situations that can arise that are much more fuzzy. There's not one clear ethical standard. There's not one clear direction to go in. And this is where the psychologist must weigh those general ethical principles and follow that decision-making model to help them resolve the issue. So some examples. So if a client says they're going to harm someone else, what are the steps the clinical psychologist should take? Or if a minor tells you some information that the parents might have a strong reaction to, do you tell the parents or do you keep confidentiality with the adolescent? If a client tries to give the therapist a moderately valuable gift and is appreciation of your work together. You and your client might live in the same small community. This comes up a lot in Hawaii. And maybe you even have mutual acquaintances. And how do you handle those boundaries? Or what if your client just signs the consent form without reading it? We all do this at different times. You go to the doctor, they ask you to sign. You're not necessarily reading every word. But as the provider, what do you do to make sure that this is ethical? So with these examples, there's not necessarily one clear-cut option or course of action. And so that's where it becomes much more important to kind of think like a psychologist and consider these ethical principles. So this week we'll be discussing 4 main areas. So confidentiality, informed consent, as well as boundaries in multiple relationships and competence. And so the subsequent videos will review each of these areas. And just kind of think about, a lot of these questions I'm going to bring up are not going to have one right answer. And so it's totally okay to express your opinion and kind of back it up with the principles. And it should be an interesting week because there will likely be different reactions from people about how they might respond to these issues.